I am Dr. Vandna Narula, Obstetrician Gynaecologist and Infertility Specialist, presently working as Senior Consultant Reproductive Medicine at Motherhood IVF and Fertility Center, Mohali and Chandigarh. So, becoming a doctor, I was inspired by my parents because my great-grandparents, great-grandfathers of both paternal and maternal, both were practicing doctors, and my extended family has a lot of doctors. So it was basically my parents' ambition and of course my ambition that was imbibed that made me enter into medical. See, specialty, the MD Obs and Gynae that I chose, that was basically because I had got a good rank in my entrance exam, and in our times this obstetrics was considered to be a number one branch, not like the present times when people are going for radiology or skin. Then after doing 8 to 10 years of general public health sector obstetrics and gynecology practice, I was like inspired by my family, and also I was inspired internally when I got some patients who came to me when I dedicatedly went into this infertility and IVF specialty. When I started doing my own IVF practice, so I had lots and lots more to offer, and that internal satisfaction was there when I started. I balanced the demands of my professional life and personal life by making a schedule for myself, by making a timetable, and of course planning ahead. You get up in the morning, of course you have to look after the household work, you look after the whatever is happening in the, and everything has to be done before one starts for the hospital. Then your professional needs, we need to do dedicatedly everything that is that we have to do in our hospital. We have to see the patients, we have to give them the best. Then of course you being a lady doctor, we need to give, being a mother, being a wife and being a daughter, I need to give time to my family also. And of course, yes, it's a kind of hectic schedule, but still it's manageable. Run around, do things, and it's manageable. If you really want to be in this field, and if you want to be in the medical field, you need to understand that you have to sacrifice. See, becoming a doctor doesn't mean earning a lot of money. Yes, of course money will come when you work in any kind of profession, but I would say you have to be very dedicated in this profession because you are dealing with human bodies, human psychology, human mind. So you have to be prepared, and if you are a die-hard like a person who wants to work hard, who really works hard, then only you should choose this profession. I remember a patient that was maybe around 10 or 11 years back. I was hesitant putting in embryos in that patient. Her lining was not that optimal. The endometrial lining, I still remember the endometrial lining was maybe 6 mm or not even 6 mm, and it wasn't that trilaminar as we normally want for a patient. But that patient was like, I cannot come back, please don't freeze my embryos, I have to go now. It's like, it's very important for me to have the embryo transfer done in that cycle. And at that time we used to do day 2 transfers, and I remember putting in 3 day 2 embryos in that patient, and it was really a miracle that she conceived. She had triplets. I still remember that patient was so strong mentally. I remember she was a sarpanch of a local village in some like a rural hill village. She was from that place, and she carried those triplets to around 33 weeks to my surprise, and I still remember her face. It was like it was very happy, like for the family, for us, when she conceived, when she delivered. Yes, she had 3 daughters, but the entire family, like what normally we see that there is a bias when girls are born, still we see nowadays in our practice. But when she had 3 daughters and everybody was so happy, they celebrated well, they distributed sweets. I still remember that patient.